Hello and welcome to the Elite Health Online podcast. My name is Boomer Cornwell. I am one of the co-owners and founders of Elite Health Online Telemedicine, and we are very happy to have you with us today. You're in for a treat because we have somebody very special with us, one of our patients. And so one of the things that we like to do with Elite Health Online in this podcast is to really speak to you, the audience, in terms of our patients and to share patient stories and to have our patients here so that, one, you realize we are a real clinic, but two, to have them talk a little bit about their journey and their success. So today in the studio, we have Danielle Walker. Hello, Danielle.
Hey, Boomer. How are you?
Good. Thank you for being here.
Yeah, thank you.
So Danielle's been with us for a while. A quick little background. I met her a couple of years ago at the gym. I'm going to let her get into the details about how she started on her health and fitness journey. But Danielle, first of all, just tell us a little bit about yourself. Where are you from and what are you currently doing?
Hi. I actually am from Florida. I was born and raised in Florida. And then I moved to Texas about 6 years ago. I currently am a cardiovascular registered nurse. I've been doing this for 17 years, all in the CV world.
17 years.
17 years,
I didn't know
yeah.
that. That's cool.
Yeah. So I kind of, going into college, I knew exactly what I wanted to be. I knew I wanted to be a nurse. I knew one of my sisters has a heart condition. And I knew at an early age that that's exactly what I wanted to follow my passion in and to be into cardiovascular health, and cardiovascular disease. So I followed my dreams and here I am still doing the same thing.
So out of curiosity, why Texas? What brought you here?
My husband works for Caterpillar. And so we traveled throughout. We were in Indiana, Illinois, North Carolina, and then we moved to Texas for his job. So, and being a nurse, I kind of was always like, all right, let's go.
Yeah, you can kind of go anywhere.
I can go anywhere.
Yeah.
So I knew anyone would take me. So
y'all like it here? You going to stay here for a while?
Yeah. I told him, I was like, we're done.
Yeah.
We're not going.
Yeah.
We're going to move. The kids are in school and in sports and lacrosse and everything. And we love the area. We love all that it has to offer. Oh, yeah. And honestly, the healthcare industry is really, it's up to speed. It's up to date. I couldn't really ask for anything better. If any of my family members or my children were to get sick, I'd be completely comfortable.
Yeah. No, this is a really good area. I recommend you guys stay and hopefully you stick around for a while. So this is what we always do whenever we have a patient on here is get a little bit more background into your health and fitness journey, right? Mm-hmm. So kind of walk us through that a little bit. Was there an aha moment for you, or was it just kind of people encouraging you to do this? Have you always been in the health and fitness industry? I mean, kind of walk us through that progression.
I've always been working out. I went from doing like classes, Les Mills classes, probably when I was 24. Mm-hmm. So probably it's been about 12 years since I've been doing it. I did CrossFit. I did Les Mills. CrossFit, I hurt my hip. And so I've always worked out. I've always been an avid workout person. Mm-hmm. And then when I joined F45, I kind of started to see results where like, hey, I'm like, why am I not progressing, further? Why am I not like increasing my weight? Like, what am I doing wrong? Why can't I see a difference in myself?
And this was how long had you been, because were you there before I was, or we were there about the same time? I know that.
I think about the same time.
So it's been a couple of years, right?
Yeah.
Okay.
So, and I never really thought anything twice of it. I mean, I'm so busy with the kids, with, life in general. And I'm just like, if I can just work out for an hour, it's my sanity space. Right. I'm going to keep doing it. I can't focus on, my physical appearance or obsess about it anyway.
Right. So, obsess about it. Sure.
Yeah.
Well, so before we get into too much detail, what's kind of your daily, weekly fitness routine now?
I wake up every day at 4 and I attend the 8 o'clock class. Mm-hmm. And then I do that 7 days a week. 7 days a week. Yeah. I should probably scale back.
You should probably have like a day of rest in there somewhere.
But I feel so guilty, Yeah. So, and it's so funny because people are always like, oh, you don't know that, working out every day doesn't make it. I'm like, it does. And it's so funny because I have to tell you this story. It's quick. Mm-hmm. My boss, one day I didn't go to the gym in the morning. And we had a one-on-one or something. And afterwards, he's like, hey, did you go to the gym today? And I was like, I don't know. Why am I answering this question?
Yeah, exactly. This is a one-on-one.
And he goes, no, I'm just asking.
Mm-hmm. Right.
And I said, no, I didn't. And he goes, I think it's best that you go.
Really? Man, that could be a compliment or an insult,
right.
I guess.
No, and so my husband is the same way. Right. Sometimes if I get called in the middle of the night for an emergency or something and I can't make it, he'll just say, have you worked out today? So it's just funny how, like, for me, it really sets my mood for the day. It sets my morning.
Amen.
It sets, sometimes when I go in the afternoon, and I don't go in the morning just so I can sleep a little bit, my staff will say, have you gone to the gym? Or they'll, and I'm like, do you guys really know? And they're like, yeah, you're just not like you.
Right.
You're just,
That's right.
So I always tell people it's so funny because I never really believed how strongly, like I knew I had to do it for my sanity, but I didn't know how strongly, like it really does impact.
It does.
100% your mental capacity, your function, and everything. So,
well, I think you said it best. I mean, you hit the nail on the head. It sets the mood and the tone for the overall day, right? Truth be, because I do the 5 a.m. class as well. Truth be told, I don't like it. Yeah. To be totally honest with you, right? I don't want to do it then. I like working out. I love working out, but I would rather do it at 2 or 3 o'clock in the afternoon. That's just not practical, right? So over the course of, however many years I've been doing this now, I've noticed the same thing, that if I don't do that early morning workout, my tone and mood for the rest of the day is not very good. It really takes a profound effect on it. It really does. Well, talk about your diet and nutrition a little bit. So how's that?
So I do macro counting. So I kind of track my meals throughout the day. My biggest, and that's what I kind of noticed over the years too, is like my protein. I really need to increase my protein, which is really hard for me. Like I'm not a big meat eater.
Really?
I'm not.
Oh, man.
But I do macro counting. I meal prep on Sunday for the full week, and then I've started meal prepping for dinners too, so I can take and go. So I've noticed that when I am on track on that, and I make sure that I drink my water, I do see a big difference. It's just being that disciplined and that too is very helpful to me too.
Well, that would be helpful vocationally, I would imagine too, because like we were talking earlier, the nature of what you do, you're kind of in crisis mode all the time, right? So it's not going to be very easy, let's say, to stop and go, oh, let's go grab lunch someplace. That's not really your world, man.
Yeah,
you have to have something there, or you may not eat that.
Right. It's 24/7 on call, and that's why I've started to do dinners too, because there are times where I just pack a lunch to keep in the fridge at any time because I don't want to go out to eat. I don't want to go to Chick-fil-A before the case at 5 p.m. Like I want to be able to eat my own food.
That's right.
I'm a little obsessed about that too. So. Yeah.
So it's one of the things too that we harp on, and we probably don't say this enough, honestly, but we encourage the providers to go over this, obviously, and they do with the patients around the success rate with the diet and nutrition, right? I mean, we can address the hormone issues and the thyroid issues, and we can address getting the wellness and vitamin levels and that kind of thing, and we get into all that, but what we really and truly can't address for the patient is that diet and nutrition component of it. We can tell them what to do, but we don't really have a lot of control over them actually doing it, right? Or they could be totally lying to us and saying, well, I'm doing everything you say, right? So, but that's 80% of the success, right? And what we've noticed, to your point, is the people that really have the greatest, or see the greatest level of success are the ones that do the meal prep, right? Again, maybe it's more necessary for you because of what you do for a living, but even if you didn't have to do that, that would still be a recommendation. It's something, quite honestly, I used to do, and I've completely gotten out of the habit of doing it. And I would finally probably get rid of the 20 pounds I want to get rid of if I will go back to doing it, but I just get lazy on Sundays and I don't do it. So, wow. Well, okay. So let's go back a couple of years ago, and you and I were talking in the gym one day, and you said, maybe I should get my levels checked, right? And I don't think, but you said, I remember you said, I don't think I'm low. I don't think I'm low. And I said, how
just
are you?
For baseline, Boomer.
Right.
Okay?
Let's just see what it says, right? Yeah. So we did it. Okay. We got the labs ordered on you, right? And I made you a bet that you were going to be low, right? Because you had never previously done much with therapy, correct?
No.
Okay.
Not at all.
And do you remember what your testosterone came back at?
Undetectable,
right? So every lab has a cutoff where they can't.
And I didn't believe him.
Right?
I did not believe you. I was like, "Are you sure you had the right patient and the right date of birth?"
Didn't mix up the tubes or anything, right? Nope, that was it. Yeah. So it was below the cutoff level, right? So you came online and you spoke with one of our nurse practitioners, and she got you on a therapy. Tell us a little bit about that. How is that? Are you still on it?
Yeah.
And then how is that therapy going? What did you notice? And I guess let me preface this a little bit. So most people, and I would say especially the female patients, they are symptomatic, but they don't necessarily know it, right? Because a lot of times the symptoms are very, very gradual. Okay, us guys, I remember what it felt like to be loaded with testosterone at 18 years old, so I'm a little bit more sensitive to it. When I was 35, and certainly now that I'm 46, I'm really sensitive to it. Probably not as much for the female side because it seems to be a more gradual onset, and maybe they don't recognize those symptoms as much, right? So talk a little bit about that. If there was kind of this aha moment, but then go into your therapy and how that's working for you.
Yeah, sure. So I didn't really know that I was symptomatic, really. I mean, I didn't really have any symptoms. Yes, I have a high stress job. I have 2 boys who are in sports, and I have a husband who works a lot. So I'm all constantly on the go, and I still get up and work out at 5 a.m. I didn't really know that I was tired, or maybe I did. I didn't realize it, but I did. That's one thing I noticed is that, like, oh my gosh, I do have energy. Like, I do have energy to keep going in the evening, and then I'm not like crashing.
Right.
And I remember you were saying, like, as you work out, and because you work out so much, it like kind of takes away that testosterone.
It can.
And so I don't remember what milligrams I was at, but then when I had switched jobs to more of a management role, I noticed that I was so tired. Remember, I came to you and I said, gosh, I'm just so tired, Boomer. I just don't understand why. Because we had cut my dose in half.
Oh, yeah.
Because she was like, yeah, you're a little high, And I said, okay, well, we'll cut it in half because maybe that's why I'm gaining weight,
Right, yeah, right.
So then I'm like, okay, well,
Yeah.
it's not the meal. Well, we'll cut your dose in half. And then I really started to notice what a difference it was. I was so tired. I wasn't sleeping good. I was waking up in the middle of the night. And then we had my levels rechecked, and she was like, oh yeah, you're back to being really low again. And so I said, really? She's like, okay, we'll rebump it. And that's kind of where I was like, wow, this really does make a huge difference. I sleep better. My clarity is better. I have energy. In the gym, I feel like I can push myself a little bit more as far as the weight goes.
Yeah.
Like, I remember before I'd be like, I don't know if I can pick this now. But, oh, that was really easy. Where did that come from?
All of a sudden, yeah.
So I feel like in those aspects, like I saw a big difference when it was given to me, then kind of taken away from me. And then giving it to me back. Like, I'm like, okay, this is real.
Yeah, it's real, and it really works, right? You hit on something that I would say most of our patients, and again, I'll say the female patient because you're one of our female patients, that's one of the first things they report. It's kind of 2 things. They report better sleep, and then they report that the brain fog's gone away. But the funny thing is that, and I think this is across the spectrum, is most people realize they're not sleeping well. Most people kind of, well, maybe not most, but a lot of people don't necessarily know that they're even really experiencing that much brain fog because that's one of those gradual onset things that they just kind of go, oh, I must be tired today, or gosh, I've got too much on my mind. They don't realize it's hormone related, right? So they get on their hormones, and all of a sudden it's like, my brain fog's gone, I mean, the fatigue is better. Still kind of tired at 2 or 3 o'clock, right? But I mean, look, I've always said we can't beat the clock. We're never going to beat the clock.
Yeah, it's not. Am I still tired in the afternoon and the evening? Sure, I am a little bit. But like to your point, you don't notice that you're symptomatic till you actually are given something, feel the effects, and then it's almost taken away. And that's the correlation.
Right.
You know what I mean? Like like I go into a deeper sleep,
Sure.
I've noticed even, I have this Whoop band that kind of tracks your recovery, tracks really how you sleep. And I've noticed a difference even when I take the testosterone weekly. Like I sleep really, really good. And then I can tell when I'm needing it because I start to wake up a little bit, or my light sleep is increased towards when I'm needing my injection.
Yeah. Okay. So that wow, just on point, right? So injections, because in one of the previous podcasts, we talked about the various forms of administration, right? You've got troches, you've got pellets, you've got creams, you've got injections. We clearly are big fans of the injections. I mean, 1, because they can self-administer at home, but 2, because we just feel like they work better, and we really feel like they work better, in particularly for women, right? Because you mentioned something a second ago about kind of burning through your testosterone. Like the harder you work out, and you work out hard, I've watched you, right? The more you work out, you can burn through those levels of testosterone, especially if your endocrine system is not producing it as much anymore, and you're giving yourself an exogenous source, like pellets, for instance, would be an example of what I'm talking about. A lot of people, and typically in the OBGYN world, they gravitate toward the pellets. Well, they work out really, really well, Okay. Because again, you have that female patient that didn't realize she was symptomatic and she has pellets for the first time and she feels great, right? But with pellets, you can burn through those extremely fast, right? And especially if you're really, really active and you have a good amount of muscle content, you'll burn through them. And so what should last 3 months only lasts a month and a half or so, and all of a sudden you're feeling bad again, you know? So that's why we are really big supporters of the injections, right? Because the injections, it's once. Are you on once a week?
Yeah.
Yeah. Okay. Once. How long have you been doing it now? The whole time? Did you ever take any time off? I know you went down a little bit.
No, I've never taken any time off.
Okay. Okay.
And I don't want to.
Well, exactly. You know. So, okay. So let's talk about that, because that's one of the myths too. When we talk about this a little bit, but one of the myths is that I can get on therapy for a little while, I can feel better, I can get my level back up to where it needs to be, and then I can come off my therapy. Okay. Well, you can, but you're going to go back to feeling like an absolute mess again very soon, right? Because when I say we can't beat the clock, right? Between the ages of 15 to 25, our hormones and everything about us, okay, every function that we have is working almost perfect, but certainly harmoniously, right? It's the best we're ever going to feel. It's the best we're ever going to function. It's the healthiest we're going to be. Our recovery is like that, you know. Nowadays, as you get older, recovery kind of hurts. You know, if you have knee pain or shoulder pain, it sticks with you for a while, you know. But one of the aspects that I don't feel like our healthcare system teaches enough to patients is when you start this therapy, okay, you're on it. You're not going to come off of it, right? I've said several times, but you know, for those who haven't heard this yet, the very first provider that ever put me on therapy at 35 years old told me, he said, "You're married to two things now. You're married to your wife and you're married to your HRT therapy." You know, and that really didn't sit well with me at first. I thought, I don't know, man. I'm 35. Yeah. I don't want to do this forever. I could have 60 years left on this planet, you know? And he goes, well, yeah, if you want it to be a good 60 years, you'll do what I'm telling you to do, you know? And I still didn't want to buy it. So a few times since then, I've taken myself off therapy, you know? And sure enough, within a month, I feel terrible. And I'm sitting there trying to kid myself going, oh, my body will start making it again. No, it won't. It won't. There's a point in time when it just won't do that.
Yeah. Well, and to your point, you know, you can take that even back to vitamins or blood pressure medicine. Yeah. When you take it, your body uses it, right? Your body takes those vitamins, uses those up. Your body takes blood pressure medicine to lower your blood pressure. But you can't start to have good blood pressure and then take yourself off and expect your body to just it's going to go back to, because it doesn't, as you age, your organs age too, right? So I think that, you know, that's part of healthcare, and a part of, you know, learning and growing and having knowledge is learning these things about your body and what therapies that we can do in order to prolong the delay process, or prolong, you know, heart disease, or you know, anything like prolong. You can't reverse aging, right? But you can also help your body age, right? Gently, you know?
Can't, right? And that's the whole beating the clock, you know, kind of metaphor that I use, right? Because, and what I've really been very happy with over the past few years, I'll put it that way, very pleased to see, specifically like in your part of the world, in the cardiovascular area, right? There's still some people out there that have this very old school way of thinking. They believe that anything like this is very detrimental. They think, oh no, you know, testosterone thickens the blood. We can't, you know, and it does, right? But I really seen the more progressive kind of cutting edge cardiovascular specialists embracing this therapy. You know?
They are, and studies are showing, you know, I have a new female cardiologist from Mayo Clinic who just started, and I had asked her, you know, so what are your thoughts? You know, and she's like, well, you know, the studies are it's starting to just now become a topic. And there are studies that kind of go both either way. But it is a high topic that people are investigating now and are researching. And I think that's great. Like, I think that's great for women too, to be able to age without having to go through menopause terribly, or, you know, like to be able, I always tell people knowledge is power. Right. And that's why I always wanted to get tested, because I'm like, all right, I'm getting older. I can't beat the clock, but I want to be able to be ahead. Yeah. Instead of behind, not thinking that I was already way behind. Right.
Well, it creeps up on you.
Yeah. You know, or I just didn't, I honestly, truly thought that my labs would come back completely normal and I would just be baseline. Right. You know, but I knew in my head, okay, this is my normal for preparing, and I'll get checked every year, blah, blah, blah. So,
well, and it's a good point too, because, I think you use the term my normal, right? And that's exactly the way that we look at this is let's go get a baseline and see what your normal is. But one of the things we tell our patients too, and I think you and I talked about this, is that even if it comes back as normal, that's not necessarily where you need to be.
Normal, right?
Right, and it's not your normal. That's exactly right. Because we have patients. In fact, I talked to one of them yesterday, a female patient, that she has to get her testosterone very high, almost to a male level, or she is symptomatic, right? So that's one of the things we do is we treat the symptoms, right? We're not going to sit there and put oodles and gobs of hormones into people. That's unnecessarily, we don't do that. But I mean, we do treat to your symptoms. Maybe you're at a certain level that on a lab report or maybe an insurance scale says is normal. But if you're symptomatic, we have to treat you. That's right.
Correct. And that's why I always tell people, that's why it's important to get labs done as healthy as you are, because that's going to be your true normal. And then when you start to veer off, you'll have backup data to say, okay, well, this was my normal, so we need to get back to that. So.
And it's not everybody else's normal, right? That's the other side of this conversation.
Unique.
Because one of the things that always bugged me, I was in lab testing for years and years and years, is the lab values that we have that we go off of, right? And it's the big labs that produce the data because they have the most information and the most data to give. Well, they give us, okay, well, based on all these values, we see this as being the reference range. We see this as being the normal value, okay? But it doesn't make sense. Could you stop and think about it? That traditionally, healthy people didn't go to the doctor, right? I mean, our entire healthcare system is based on sick medicine, right? Now we're trying to change that dynamic, that paradigm shifting a little bit. But for forever and ever and ever up until just a short while ago, it was based on a sick population. So sick people were going to the doctor and having their blood drawn in either unhealthy disease or, aging, right? So they're over 40. So now we have a population of, over 40, sick, disease-ridden people getting their blood drawn, and we're telling the world that that's what the reference range of these lab values are? No, that doesn't make any sense, okay? If we tested healthy 25-year-olds, we would get a completely different idea of what a normal reference range would be, right? So that's a good point, and I think, so just to kind of expound on that a little bit and to let the audience know too, that's one of the things that we do at Elite Health Online is we do want to take good care of our patients, okay? We don't expect that if we put them on programs, we don't expect that the patient's going to change their program or do anything drastically different, but we do monitor them. And in fact, we kind of require it, right? We want that patient having a regular check at every 6 months. We do the lab checkups. We get them on the phone with their providers. We go over their symptoms. What are they experiencing? That kind of thing. We were talking earlier, that's one of the differences between what we do and these T-centers, right? That you can just walk in off the street and they don't care. They don't care. They don't care. They don't care at all.
They'll inject you with the max dose. Be like, oh yeah, this is what you need. You're good. You know, and that is unsafe.
It is.
I mean, I would
without looking at anything else, right? They're just checking a testosterone level and that's it. They're not looking at anything else, right? They may not even be checking hematocrit, which we've got to look at. So, and again, and you could probably talk more about this too, but there's value in. Because the base of a lot of what we do is testosterone. We always talk about that, but progesterone comes into play. Estrogen comes into play. Estrogen is in fact cardioprotective, right? Is it not? So we can't be messing with it too much. I mean, there's science out there that says, oh, bring the estrogen down as far as you can, and there's other science that goes, no, don't. We can't do that, right? Yeah.
And that's two things that I felt so comfortable being with you guys because it is. You are being monitored closely. You're being monitored by real physicians, real nurse practitioners who have studied this, who are putting their license behind prescribing you something.
Right.
And I think that says a lot because for me, being in the healthcare field, I feel comfortable giving you those and be like, okay, I trust you, you know. And in like you form a relationship with those people, right?
Sure.
Like just like a physician, you have the same person every time. Even the lady who calls me to schedule, like she's just so nice. Like you develop relationships in clinics like that who you just go and inject. They don't care, And so it's kind of like you get what you pay for, right?
Yeah.
And I think when you're messing with somebody's health and somebody's hormones, I'll put money on that any day to be able to go to somebody who really values me as a person and values my whole body and how I am than just, okay, you want to shoot up, or whatever.
Right, yeah, exactly.
You know what I mean.
I know exactly what you mean, yeah. Well, we're going to wrap here in just a minute, but I'm kind of putting you on the spot. Do you have any health and fitness goals for this year? Anything you want to accomplish? I mean, you looking to run a marathon? Oh, you do the High Rocks.
I do High Rocks.
Okay,
yeah,
talk about
yeah.
that for a second.
So, I do the High Rocks competition. It's every 6 months, and I do it with a partner to be able to complete. It's kind of like a CrossFit.
Do you have to do it
competition.
with a partner?
You don't, but that would be very hard to do it just one person. But so I've paired up with a partner to kind of, it was my first competition really I had ever done. And it's more about endurance and things like that. But I would be curious to honestly see. I almost wish that I had done it prior to my therapy, because when you're pushing 175 push sled, 175 pounds, and pulling 175. I would be curious to see if I could even do that.
Yeah, before all this. Yeah.
And maybe I could.
I'm sure you could, up to it, but
it wouldn't be. It would be taxing.
Like the endurance would not be there, probably, right? Yeah, that's interesting.
So,
okay. So what are you going to do? You going to do some more High Rocks? You got something else in mind, or what?
I don't. I really kind of want to lean a little bit.
Okay.
But I don't know. I'm not too thrilled about that. I don't know. I just kind of want to keep going. Keep up my routine and kind of maintain it.
Yeah.
And really start to dial in on more on nutrition. See, because as I get older too, I found I can't really process dairy that well. It's so kind of just kind of fine tuning that, taking a bigger deep into, making sure I'm green on my Whoop thing, my sleep, and, because sleep and nutrition, those are two of your most important things, and they're so basic, right? And stress. Right. So I'm kind of trying to focus more on not being so vanity driven, but being more like quality, and making sure and seeing how that may play into my physical appearance.
Isn't that funny how you're not old, but as we get older and we have families, the looking great and popping out of your shirt and, fitting in your little bikini, it's not as important as it used to be. Right now, you really do. You're like, I've got kids. I want to be here for them. I want to be active. I want to be able to engage with them. I want to see them graduate. I want to see them get married, and I want to have grandkids, and I want to be mobile for my grandkids. I'm not going to be that granddad or grandma or whatever sitting in the rocking chair unable to move, man. I mean, I'm not going to do that. I watched my parents do that, and I'm just not going to do that.
Yeah,
I mean,
I agree.
Not going to happen. So,
and if you ever feel bad about yourself, just go on a cruise, and
right?
You'll be the skinniest one there,
right?
So.
Good point. Yeah, man. Yeah, that's a good point. That's funny.
So anyway,
well, good.
Good.
Well, I really appreciate you being here with us today. This has been cool.
Yeah.
We may even do this again. Maybe we'll check back in later this year, get an update, see how the High Rocks is going. Yeah. So that'll be fun.
I'd love that.
Well, good.
No, I love fitness. I always, I was going to open up a gym.
I remember you telling me about that.
I was going to quit nursing and open up an F45.
Okay.
But God had other plans. But I love fitness. I do. And it's my passion, and I love telling people your nutrition, it really does make a difference.
It really and truly
does. So I love talking about it. So sorry if I continued on.
No, that's okay. No, I do too, because again, it's so much of what we do, right? And especially again, as we get older, I wish I could go back and tell my 19-year-old self, nutrition really is important. Stop eating at Subway, stop eating at Taco Bell. Stop it, But I didn't care because I could eat like that back then. And I wasn't gaining an ounce, So what did I care? Oh man, if I could just go back and say that, But as you get older, you get more in tune to that kind of thing, and it becomes more important. Yeah. So, well, that's cool. Well, good. We're looking forward to checking in with you later.
For sure, I'd love that.
So do this. Go to www.elitehealthonline.com. Click the banner up there to learn how to become a patient. You can schedule an appointment to talk with one of our hormone optimization specialists. Get scheduled, get some labs. Our labs and consultations are free. We don't charge anything for those. And then one of our providers will recommend a program for you, or they may recommend nothing. If everything comes back fine and you have a consultation, they may just say, keep doing what you're doing. So we're not here to push anything on you. We're here really and truly to take care of you, like Danielle was talking about. So again, www.elitehealthonline.com. You can take a look at all of our products. We do want to address the hormones. We want to address the sleep. We want to address the fatigue. We want to address the sexual wellness, the weight loss. We have a whole array of products that we want you to check out. But again, go online, click that banner, become a patient, and we'll see you online. Thank you.